Casino Reopening Safety 101: Achieving Social Distancing Goals Without Reducing Seating. Presented by HESS Advanced Solutions. The Nevada Gaming Commission unanimously approved the Gaming Control Board's reopening policies, laying out what more than 400 large and small casinos need to do when shutdown orders are lifted. Gaming machines. Licensees must ensure that the floor plan for gaming machines creates proper social distancing between patrons. Licensees may remove every other chair or stool in front of gaming machines or cover a machine's bill and ticket validator so that patrons do not use that machine. Separating guests by plexiglass to meet social distancing guidelines. Will casinos and restaurants be adopting this setup in the future? It's unlikely that methods such as this will be effective, as infectious clouds travel above and across barriers. Watch this.
One of the top questions we see from you: how does the coronavirus spread? Scientists are revealing new answers every day. The main method is when an infected person coughs or sneezes, sending out droplets into the air. Early research showed those droplets could travel up to 6 feet, but a new group of researchers thinks it could be even further. Take a look at this. This is a model they created that shows what happens when you cough in a place like a grocery store. Look at that. Look at how the cloud spreads. The researchers say an infected person could cough and walk away, but they leave behind small particles carrying the virus, which can end up infecting others. And those particles can live in the air for a while. Researchers at the National Institutes of Health, the CDC, UCLA, and Princeton found the virus can live in the air for about 3 hours. On plastic, it can live for 3 days. The same with stainless steel. On copper, 4 hours, and on cardboard, up to 1 day.
Areas of concern within commercial and Native American casinos include slot machines, gaming areas, public areas, lobbies, food service, dining rooms, and back-of-house offices. The VidaShield UV24 system uses UVC and filtration to draw in and treat environmental air. UVC has been shown to kill SARS-CoV-2, the virus that causes COVID-19. When exposing microorganisms to UVC light, the light penetrates through their cell wall and disrupts the structure of their DNA molecules, prohibiting reproduction.
So really heavy particles like fungal spores will not be in the air as long as a really light particle like a virus. We know that studies done in major cancer centers have shown that the particles are most disturbed when the room is being cleaned, and that some of the biggest risks, or the greatest risk to the patient, is putting the patient back in the room after the room has been cleaned and all the particles are stirred up. In many regulatory settings, such as OSHA or EPA, there are regulatory controls, and there's a thing called the hierarchy of control. And most people would agree that the highest step on that is to have an engineering control. And by an engineering control, I mean a control that takes care of the hazards in the environment without requiring human intervention. So in the case of a VidaShield unit, the unit goes in the ceiling, it draws the air in through a MERV 6 filter, through a series of fans, passes over the UVC or the germicidal bulb, and then it goes back into the room. No one has to touch the unit to make it work.
The National Restaurant Association has published a reopening guidance on social distancing. They recommend updating floor plans for common dining areas and redesigning seating arrangements to ensure at least 6 feet of separation between table setups. Guest rooms, restrooms, Kitchens, lounges, and fitness areas are of primary concern. The red squares represent open tables. The blue circles illustrate the 6-foot social distancing guidance recommended by the National Restaurant Association. Adjacent tables within the 6-foot radius need to be closed to conform with the NRA guidance. Of the 82-seat capacity, 34 must be closed. This represents 41% of the available seating. VidaShield will sanitize the air, removing 93% of the coronavirus at a rate of 50 cubic feet per minute. One unit will sanitize 271 square feet every 43 minutes. A restaurant of this size and configuration will require 4 units to achieve 93% zonal protection every 43 minutes. Units can be installed in the ceiling or suspended and can be configured to match the casino or restaurant's aesthetics. Some casino and restaurant owners prefer the units to be conspicuous so guests can see visible evidence that their health is being protected.